Thank you, Madam Speaker. House Bill 3391B, also known as the Reproductive Health Equity Act, ensures that all Oregonians receive the full range of preventative reproductive health services they need at zero out-of-pocket costs, regardless of their income, citizenship status, gender identity, or type of insurance. I believe that affordable access to reproductive health care shouldn't depend on who you are, where you live, or how much you earn. Health care is a basic human right. This bill requires health insurance plans to cover a full range of contraceptive and preventative care without cost sharing, including STD screenings, certain cancer screenings, vasectomies, IUD insertion, and abortion. It also requires that the Oregon Health Authority implement a program to reimburse the costs of reproductive health services to individuals who would be eligible for medical assistance, if not for their immigration status. This program also includes coverage for 60 days of postpartum care. The bill includes compromise language that allows for certain exemptions for plans sold to religious employers, as defined in ORS 743A.066. There is also an exemption to the requirement that insurers cover abortion services if an insurer excluded that benefit in all its plans during the 2017 plan year. The bill directs OHA to design a program in consultation with the Department of Consumer and Business Services to provide statewide access to abortion coverage for Oregon residents enrolled in those health plans where abortion is excluded. This bill also prohibits discrimination in reproductive health coverage on the basis of race, color, disability, and other protected classes, including gender identity. This provision will help remove procedural barriers that many transgender and gender nonconforming Oregonians face in accessing care. Madam Speaker, over the past 6 months, the legislature has had hearings and informational sessions where we've heard from Oregonians like Caden Merrill, who is at risk of cervical cancer but faced barriers to getting coverage for the hysterectomy that his doctor recommended, simply because his insurance provider didn't have a code that would allow a transgender man to have this procedure. This bill would go a long way towards improving inequities in our system, such as the one faced by Caden. Thank you, Madam Speaker. Thank you, Madam Speaker. What you've heard on this floor today is a discussion of our values as Oregonians. This bill is about equity. It's about the economy, and it's about public health. I want to take a minute to talk about a few points that were raised during our discussion today and in committee to clarify for the record. First off, the intent of this bill is to require that insurers cover abortion services for all legally permitted abortions. Secondly, as it relates to the exemption for religious employers, our intent is not to change, broaden, or narrow the exemption that currently exists in statute for contraceptive coverage. If an employer meets the definition of a religious employer in ORS 743A.066, they qualify for the exemption. As it relates to the exemption for insurers in Section 27E of this bill, this exemption is based on what services were covered during the referenced benefit year. It is not based on the religious tenets of the insurer, but is only based on the benefits covered at the time of the referenced plan year. Madam Speaker, with the current conversation about healthcare at the national level, there is significant uncertainty about what protections will be maintained in federal law. Given that uncertainty, we must act to protect access to reproductive health care here in Oregon. Restrictions on reproductive health care have profoundly harmful effects on public health, particularly for those who already face significant barriers to receiving high-quality care. This includes young women, low-income women, women of color, immigrants, survivors of domestic violence, and transgender and gender nonconforming Oregonians. Early detection and treatment can help prevent serious, lifelong problems. When Oregonians have access to affordable reproductive health care, they are more likely to seek care for treatable problems like an STD or a lump in their breast. Madam Speaker, when I cast my vote today, I'll be thinking of Oregonians like Gloria, who need access to postpartum care. Gloria spoke in the Capitol about how just 3 days after the birth of her daughter, she was rushed to the emergency room with heavy hemorrhaging. She testified, "If I had not had access to health care and medication to stop the bleeding at that moment, I don't know what would have happened to me. Protecting access to reproductive care for all Oregonians is the right thing to do, and it will make our communities healthier and our economy stronger. Thank you, Madam Speaker.